Happy Wednesday, everyone. Welcome to another fabulous edition of Chamber Chat, presented by Bose, McKinney, and Evans, attorneys at law. Thank you all for being here. I'd like to turn it over to Alan Becker of Bose, McKinney, and Evans to introduce our speakers today.
Thank you, Brad. I know that one of the things that whenever I work with small businesses that is a lot of times a big issue for them is health insurance for their employees. And it's particularly the case now when health insurance has assumed such an important role in everybody's life. And so today we're happy to have Samantha Avers and Tom Weartz from Sterling Insurance, who will talk to us about healthcare, I think, in general. And I think they may focus specifically at some point on healthcare plans for small employers. So I will turn it over without further ado to Samantha and Tom and Brad.
Well, thank you very much, Alan, and thank you again for hosting Chamber Chat. So, hosting and sponsoring. So, Samantha and Tom, we are here. You guys, are just so everybody knows, you're an affinity partner with the Greater Lawrence Chamber, and you do healthcare for small groups, typically employers under 50 employees, all the way down to, I think, one, if people want to go down to one. Am I correct in that?
Two.
Okay, you can go down to two. One just sends you into the marketplace. So first, let's start off. Introduce yourselves to everybody, and then I'm going to ask you some questions, and then we'll open it up to other people who ask questions about healthcare and the future of healthcare. So take it away. I'll let you say what you want to say, and then we'll start asking questions.
Well, I'm obviously Tom.
Age before beauty, right?
And this is Samantha. So just in case, you got confused there. So I'm president and founder of Sterling Insurance, and Samantha is our business development director.
Director of one.
So as far as employee benefits are concerned, we're excited to be launching the Greater Lawrence Chamber program. It's non-ACA, so unlike the brand names that you're familiar with, United Healthcare, Anthem, those are ACA plans. These are a small group program that requires medical underwriting, and that's why we're able to come in with a plan design that's significantly lower in cost than what you would see on the ACA plans. So that's why we're excited about that. And typically you'll see rates starting about 40% below what you would see from a United Healthcare or a Anthem plan. So that's why we're really excited about launching this plan for our chamber. What else do we want to tell them about us? We've been focusing on small group for since 1997. So we got a little bit of practice at this, and we try to walk through step by step and make it as easy and painless as possible.
The program I'm launching for the small group in the Greater Lawrence Chamber, if you find yourself outside of that 50 employee range, that doesn't mean that we can't help you. We actually have groups as large as 250 employees, and we're very comfortable in that spot. So really, we're going to support the chamber regardless of the group size. It really doesn't matter to us. We're just excited to get an audience with you guys and get to know you better, and look forward to working with you.
Excellent. So let's talk about how we've gotten to this point with healthcare and where you guys think it's going. And are there going to be health robots?
Wow. I say we start with the robots. My wife works in the healthcare field, and it's so hard to get people involved. I think we might end up with robots, but not anytime soon. So in the meantime, we're going to rely on humans to take care of us. As far as healthcare, we've gone through HIPAA, which came out in the 90s. And, everybody said that was going to be the end of healthcare. And we've gone through Obamacare or the Affordable Care Act, and everybody said that that was going to be the end of healthcare. And, as you can see, that hasn't occurred. It's funny that we're having this conversation today because we officially have a new president as of an hour and 40 minutes ago. And I don't see any huge swings as far as the Medicare for all or whatever. I think we're going to continue forward like we are. I think if we're smart, we may end up with some additional assistance from the government, from a monetary standpoint, kind of like the way the exchange was originally set up, was designed to help the lower income. I wouldn't be surprised to see if we come out with some kind of a subsidy for small employer groups, because they seem to be the ones struggling the most. And I think with the pandemic that's occurred over the last 12 months, 10 months, I think that might be something that you see come through in the next 6 months. And where we go from there, I really don't know. I wish I had a crystal ball. I'd put all my money in that market, but unfortunately I don't. I just have an educated guess.
One thing I read about actually was the rise in premiums for the large carriers. So you've got your 7 basic large carriers. Here in Indiana, we basically have United Healthcare and Anthem. But because during the pandemic, there were a lot of procedures that were elective or just not considered necessary at the moment, there was a delay in claims. So there's been a lot of claims that would have originally come through at a normal time frame and are not coming through at a normal time frame. So some of the literature I've read has said that fully insured premiums could rise as much as 40% in the next 6 to 12 months, just based on dealing with the COVID pandemic.
So let me ask questions. We'll start with, you mentioned COVID, and so I had some notes here of things I wanted to ask. Who is paying for all these free COVID tests? I mean, people who are administering them are getting paid. How's that money flow?
Actually, a lot of it was, so if you had a group health plan, and so if you were, had coverage, just like your wellness package, those items ended up being covered. So when they passed some of the CARES Act and all that, they kind of told all the insurance companies, you're going to cover this just like you would the flu shot or your annual physical. If you were covered from that standpoint, you were covered. If you didn't have coverage and you went and got a shot, let's say at a local clinic or the CVS or whatever, the federal government gave the states grant money. So various providers were providing the testing, and that was all funded through grants. So one of the local FQHCs here that we work with, they received grant dollars and actually created a mobile unit, and we're going around Bartholomew and Johnson County and some of Southern Marion County and doing different locations throughout the week. And they were testing anywhere from 80 to over 100 people a day. And then they were doing all of that based off of a grant that they were given. And so they weren't really making any money off of it. It just was a part of their overall mission statement to provide care. So they're now administering vaccines now. And again, if you aren't able to pay for it or you don't have health coverage, these clinics will administer it, and they'll file it under the grant, or as a part of their grant, provide you with those vaccines that you need.
All right. Well, and I'm just thinking there's a clinic down here on the corner of Sunnyside and Pendleton Pike. And for the last 8 months, I mean, their parking lot's been full. They got a sign out front, so it's free COVID tests. And, I'm like, all right, they're getting paid from somebody, and they're doing robust business. So
They're probably getting, they're working with grant money from the state and providing it. And, but a lot of those clinics really aren't actually making enough money to cover the cost. So, but, you know, again, the government's giving you dollars and you're supposed to provide these services. And whether you exhaust all those dollars or not, they're expecting you to, you know, to continue on. And then with most of the clinics like that, you hope that you can recoup that money at a later date, either by filing for additional grant money to cover your cost or expanded services and so forth. So there's other ways of getting that money back.
okay, well, and then a follow-up question on that, is the government going to become more involved in healthcare? I can only assume that they're going to be. Are they going to cover more, provide more, have more people under their umbrella?
You know, what's funny is we have a lot of people that are already under the government's umbrella. We just don't realize it. You know, you've got TRICARE, that's all of our military and their spouses and children. And then you've got the federal government employees and our congressmen, and they're all on their own government program. And then we've got roughly 40-some million Americans that are over the age of 65 on this program called Medicare. And that's a government-run, government-paid program. And then you got all those people that are under the age of 18 that are in poverty, and that's the CHIP program, which is just another arm of the Medicare. So you've got about half of the population's already covered under one form of a government program or another. The misnomer is that the government's going to provide your health care. The government's not providing any health care. The government's paying for a lot of the health care. But I mean, these people are still getting their health care done at the doc they want to go to or the hospital they want to go to and so forth. So what you may end up seeing is the government providing more oversight as far as from the provider's standpoint, from a pricing standpoint, because that's really where we're at is it's not the quality of care or it's really about the cost. And so we might see something come down the pipe with that. And what that looks like, that just depends on what kind of conversation we can actually have up there in DC. You know, who's listening and who's not listening.
Right. Well, because they have the health providers have what they have their rate that they say is their customary rate, but then each insurance company and the government negotiates their own rates, which are less than the customary rate, which then means the customary rate is not really customary. So are you suggesting that the government might just say, here's the customary rate and this is what you're going to be reimbursed at?
That could very well come to pass. That might be, if you think about it, that's kind of the threading the needle, because you've got, you know, some that are going Medicare for all, okay, but then you got people that want the private sector or want to keep their private plan or in such, and then you got the private side that's saying, hey, we want to keep all this private. So how do you thread the needle in lower cost? And it may be that it's not Medicare for all as much as it ends up being more of Medicare pricing for all, or some variation of that. You know, these are all theoretical, you know, discussion that we're having right here because, you know, like I said, it all depends on what kind of conversation occurs in DC.
Mm-hmm.
You know.
And for those of you that aren't really familiar with what the, you know, accepted cost for something is, it's American healthcare system is one of the only products that you purchase without knowing the cost of before you walk in the door, right? So, you know, we talk a lot about discounts, and a lot of different brokers talk about, oh, we've got a 40% discount this year, and oh, that's great, that's wonderful, but it's really not about the discount, because it doesn't matter if I start here or I start here, or it does matter. Wait, let me get in the screen there. For the same procedure, if I'm starting here and I give you a 40% discount, or I start down here and give you a 20% discount, right? It doesn't matter because there is no starting point. So hopefully some of the legislation will help smooth that out and make sure that everyone is kind of everyone's batting for the same team, that as far as that goes.
And the word you're looking for is charge master.
Charge master?
It's not customary, it's the charge master. That's the internal hospital, it's what the hospitals and that call their billing structure. It's the charge master. And they base their reimbursement and their discounts off of what they're charging. The only one that doesn't negotiate with the hospitals is Medicare. Medicare, so like the insurance carriers come in and say, you're going to charge me, $3,000 for an MRI. And we want a 50% discount on that. So we end up paying $1,500 for an MRI. And Medicare comes in, and it's because they're the government and because they insure so many people. They basically go, here's $600 for the MRI. Thank you very much. And if you don't like it, we'll send our patients elsewhere. And guess what? They accept it. So that's why I'm saying is they may end up coming out with a Medicare for all pricing. Now, I've heard arguments that say that pricing is not sufficient, that, the private sector subsidizes the inefficiency or the lack of funds on the Medicare side. Okay, well, then that's a conversation. Then maybe Medicare needs to come up in cost to make it so that everybody's happy and you come up with something that's palatable for everybody. So again, these are all theological discussions.
Okay. Well, I want to take a moment to once again thank our sponsor, Bose, McKinney and Evans, attorney at law, for sponsoring Chamber Chat for all of 2021 this year. So thank you very much for your sponsorship and your support of the Greater Lawrence Chamber. Now, Tom and Samantha, let me ask you, I know my dentist, when I went just a couple weeks ago, offered me a plan for next year where basically they kind of become the insurer, or they cut out the insurer, where I think it's like $350 for the year, get you 2 cleanings, an x-ray, a couple other things, and then discounts on things that I don't know how much they cost anyhow. Are we going to see more healthcare providers start doing something like that?
Dental's kind of is a little bit different because like your dental coverage typically is capped at like $1,000 or $2,000. So, but to get into the medical side, you're already seeing that. You're seeing that with like, for example, IU Health. They've got IU Health, IU doctors. They've got their own health plan. St. Vincent's or what do they call themselves? They don't call themselves Ascension Health has created their own health plan. Up in Fort Wayne, you've got PHP, and they've created their own health plan. And they do that because that way they're capturing the dollars on the front side. They're capturing the dollars when they come in, But the thing that I have yet to see is, like even with like IU Health, they're now providing the care. They're the insurance company. They're the provider of care, but yet their cost still isn't coming down. I mean, if I come out with an IU Health plan that steers all of my employees into IU Health, I'm only getting about a 10% savings. So if I'm an employer with 100 and some employees, and I'm directing all my employees into that IU Health system, my premium might be anywhere from 100 or 1.5 million to $2 million, depending on my plan design, and I'm getting a 10% savings. So I'm only saving $150,000. And out of $150,000, I'm going to get a lot of pushback that the fact that I can't go to Community or St. Vincent's or St. Francis or any of the other facilities in charge. So you would think that you would have a much more significant cost savings.
And I have a litigation background, so I often think about things as far as plaintiff and defendant.
Well, wait a minute, behave yourself here. We got an attorney on the phone.
I know. But in my opinion, there's no accountability when you have that kind of plan where they're providing the care, they're also the insurance company. It's like the plaintiff and the defendant working for the same company. I kind of like the separation of church and state there, because if, you know, like Tom said, they're not providing the break that you think you should get. And there's no recourse. There's nobody behind you to say, well, hey, you know, we're driving all of our business there. We should be receiving better discounts.
Yeah. So one other question for me before I open it up to our assembled guests, telehealth. I haven't actually seen a doctor in person now in a year and a half or 2 years, and I don't see that happening anytime soon unless I'm on my deathbed. Is that just going to be the future? I mean, are we all going to be having our medical visits via Zoom?
Yes and no. I think it's going to be a part of your healthcare plan. It's a part of the package. I've actually been using telehealth with clients for years. I began using the telehealth program with some of our rural clients in some of the outlying areas where, you know, the docs are all closed at 5 o'clock. They don't really have an urgent care, and the only facility that's open is the local hospital. So you got people coming on after work or whatever. Now the kids are, you know, we've done dinner or whatever, and you're getting the kids ready, and all of a sudden, you know, Billy's got a 102 fever. What do I do? So they're running to the emergency room, which is ultimately driving up your healthcare costs, because a doctor visit's running you, after discount, $100 or less, versus an emergency room visit that's running you $3,000 to $1,500, depending on, you know, what the discount and such is. So we implemented a telehealth program so that they could actually get a physician on there, give them all the diagnoses and such, and avoid an office visit. And we did this on a small group of about 75, 80 employees, and saved roughly $30,000 in emergency room visits just with the telehealth program. So, I mean, it can drive down cost. Now with technology, that telehealth visit was really, you know, you were using your phone and such. Now with a smartphone and that, I can send pictures to the physician. I can do like a live cam like we are here, where the doctor can actually look at the color of the patient and kind of see what their skin tone is. And so you can do a lot more with the video conferencing. So yes, I think telehealth is going to be here to stay. But I think it's just going to be one more tool, just like MRIs and CT scans. It's going to be a tool that they utilize, but it still isn't going to replace that hands-on.
Cool. All right. Let me pull up the gallery here. We have some assembled folks. Questions from those who are in the audience for Tom and Samantha from Sterling Insurance. Questions about health and the future of health. Kim, go right ahead.
Yeah, first of all, thank you guys for being here. It's good to see your face. And I was just curious about the COVID vaccine. So someone had told me last week that if the rollout of the vaccine continued at the pace at which it has been rolled out, it would take like 3 years to get 80% of the population vaccinated. I don't know if that was hearsay or what that was based on, but I was just curious about your thoughts on that.
You have numbers?
No, I don't have them. I normally do.
Actually, I was listening to a report yesterday from the CDC, or the head of the CDC. He said they're actually just shy of 1 million vaccines a day. Some of the stuff that the Biden administration is talking is expanding that out to facilities like some of the stadiums, so almost like Lucas Oil being a site, you know, or some of these other stadiums around the country. Right now, we're right at about 1 million vaccines a day is what the CDC was saying. So if that's the case, it would be down to 12 months. But their goal is to get it to where they're even more ramped up so that by July or August, they're hitting the critical numbers that they're supposed to. The biggest problem that we initially were seeing was the fact that we've got so many people, even healthcare workers, that are buying into some of these conspiracy theories, that, the vaccine's got a microchip in it and some just out there stuff. And so you had people that were refusing to take it, even though they were in the healthcare field. So I think that's starting to subside, and I wouldn't be surprised if you're going to see over 1 million, several million a day starting here within the next week or two.
My best friend's an ER doc, and she just sent me her paperwork showing that she's gotten both of her vaccines and she's still alive. So
Hasn't turned into an alien.
she hasn't, she's still, yeah.
Brad Pitt isn't, running from her. And
Her head hasn't fallen off.
Yeah,
So
she's
we're
not
good.
hiding in the dark, like in I Am Legend. So yeah, so far.
I've seen 28 Days Later. I know what happens.
There you go.
Other questions from our assembled audience? If none, then I will ask another question. So as far as the deal that you guys are offering for chamber members, give just a quick 60-second sales pitch on why this is a good deal and how that's going to benefit some of these small employers.
The reason it's a good deal is this is a program that's specifically for small employer groups. It gives them the opportunity to offer up a lower cost option than the ACA. So if I'm sitting here and I got 4 or 5 healthy people, I'm going to be able to use my age rate and the fact that they're healthy and save 40% off of being a part of the ACA. And that gets me out of the block, and I can offer up a full-blown major medical plan, for a fraction of the cost that it would cost to be a part of the ACA.
It also, if you qualify, it also includes $0 co-pays for telehealth, which is awesome, because a lot of those programs that you see out there still have a copay for that. And if you're really young and healthy, you may qualify for $0 co-pays for prescriptions as well. And the nice thing about it is with this particular plan, like you said earlier, Brad, we can go down to 2 employees. We wouldn't be using this plan for that, but we can have as small as 4 employees on this plan, which, is opening up access to that care that most people, most really small employer groups haven't had an opportunity to before. And there's also a lot of, when you think about the job market today, it's an opportunity for these small employers to attract new talent. Now that we're in this COVID world and we're all over the place, you don't necessarily have to live in Indianapolis to have a job in Indianapolis, right? So people are looking, a study I read actually said that 50% of American companies are looking to actually make their benefits richer in 2021. And that's part of the reason is because of the talent pool. We've got to find a way to differentiate as a company and go after and attract and retain those top talents. So this gives small employers the opportunity to do that, which they may not have had before.
Outstanding. I'm going to give one more opportunity for those in the gallery to ask a question if there's any other questions. Seeing none, then I'm going to go back and
well, also it benefits the chamber too, right?
well, it does benefit the chamber. Of course, I'm going to get my money.
Okay.
No, it's a great benefit to the chamber. So yes, thank you for bringing this to us. We're excited.
One of the things that Samantha was talking about was that employers are talking of enhancing their benefits, but also I think it's the National Association of CPAs was talking or did a survey and said that an employee that is offered up a benefit package, in other words, their salary plus a benefit package, would take a salary 30% less if it didn't have if you had benefits. So either I've got a benefit package that's X dollars and no benefits, or one that is got benefits and a salary, they would take a salary 30% less if it had benefits. So
the extent.
if you think not having a benefit plan isn't hurting your attraction of employees, I think you're wrong.
Yeah. Well, I know me personally, I think my healthcare plan is about 20% of my salary. So yeah, it makes a difference. So again, everyone, you've been watching Chamber Chat presented by Bose, McKinney, and Evans. Thank you all for joining us. Some upcoming events. Tomorrow night, we're having an in-person after hours at Triton Brewery. That's from 4:30 to 6:30. And Samantha and Tom have graciously offered to buy everybody their first round. I'm going to see if how big the first round can be. Maybe Triton has like a 64-ounce glass. So
A pitcher and a straw for you, Brad.
yes, please.
Das Boot.
So that's tomorrow evening. I think we've got 20 or 25 people that have RSVP'd, so that should be a great event. Expect to see more after hours coming from us just because people seem to be responding well to those, and those are the things that we can do in person. On March 4th, we're also doing our State of the City with Mayor Collier. So put that on your calendar and be RSVPing for that. Otherwise, Tom, Samantha, thank you very much for joining us. We will go back and edit this, and it will be posted tomorrow and be shareable to the world. So we appreciate your expertise and look forward to having a beer with you tomorrow night, even if you're not.
Hey, Brad, is an RSVP necessary for tomorrow night?
No, I don't think so. We just kind of want to know how many people are going to be there because Triton can only seat 50 people. So
It's a game time decision, but Triton's a great place. So
it is.
I think it was the first craft brewery that I ever hung out with when those guys first opened up.
They were one of the early ones in the industry. They've been around 10 years, so there's been a lot that have come and gone since then. So, all right. Well, thank you all for joining us, and we'll see you back here for Chamber Chat in 2 weeks. Take care.
Thanks for having us.
Bye now.